Hey everyone, welcome back. Today we're going deep on something that's actually super relevant to everyone, even if you don't realize it, dental caries.
Cavities.
Exactly. Big shout out to London Heartbeats A Academy UK for giving us all this awesome material to dig into. We're going to go from how caries, first start all the way to what can happen if you don't take care of them.
What I think is really cool is how it's not just about eating too much candy or whatever. It's an actual disease, like a microbial invasion.
Whoa, okay, so more serious than just like a sugar rush consequence. So it's like these microscopic attackers are going after our teeth and they're, like dissolving them somehow?
Demineralization is the term. It basically weakens the tooth until, yeah, you get those cavities.
And is everyone equally at risk for this?
Nope, not at all. Things like your race, your age, even socioeconomic background can make a difference. It's wild how much oral health is tied to overall health.
Makes you think about access to dental care, right? Like, if you even know about good hygiene. Okay, but let's talk food. London Heartbeats Z Academy, they really emphasize diet here.
Those refined carbs are sneaky culprits.
So they asked about the candy.
Well, partly. Early studies, actually, they took teeth, put them in saliva with bread and sugar. Guess what happened? Decalcification.
Okay, that's a visual I didn't need, but point taken. So carbs are like enemy number one for our teeth.
It's more nuanced than that. It's the type of carbs, how often, even how you eat them. Like, think of those sticky, gummy candies hanging around on your teeth for hours.
Recipe for disaster. So no carbs, but smart carbs. Makes sense. But we got to talk about those bacteria, right? The ones that are like the actual bad guys in this story.
Oh, yeah, it's a whole world in there. But the main villain, for caries at least, that's Streptococcus mutans. Turn sugar into lactic acid, that's where the real damage is done.
So acid attack.
Precisely. That lactic acid eats away at your enamel, the tooth protection. And S mutants has backup too. You got lactobacillus, steps in later to make things even worse.
Our mouths are like a war zone.
Kinda. And their base of operations, dental plaque? That sticky film gives the bacteria a place to hang out and thrive.
Ew, plaque. Nobody likes that. But are all bacteria in our mouths bad? It seems like there'd be a lot going on in there.
Good point. It's not that simple. Different bacteria, different roles. Like actinomyces, you find that more in deeper decay, root surfaces, that kind of thing.
So location matters for these bacteria too. Man, this is complicated. But there's this Keys triangle thing that kind of explains it all.
Keys triangle, yeah. It shows how caries develop. It's three things. The host, meaning you and your teeth, the agent, which is the bacteria we're talking about, and then the environment, so your diet, hygiene, all that. Caries isn't just one thing, it's how these three work together.
Like a perfect storm. And speaking of, we have this image here. What causes cavities? It's got like sugary drinks, acid reflux, dry mouth, not brushing enough, even lack of fluoride.
It's a good overview, yeah. But there's also stuff about the tooth itself, how that plays into whether you get cavities or not.
Okay, now I'm really curious. What about the tooth itself makes it more or less likely to have problems?
So, did you know the enamel on the surface, it's actually tougher than the deeper enamel. That's why those deep pits and fissures, like on your molars, they're so prone to decay. Food gets stuck, bacteria love it, prime spot for acid attack.
That's why the back teeth always seem worse.
Exactly. And it even matters which surface of the tooth we're talking about.
Okay, wait, there's more? So not all parts of the tooth are equally vulnerable.
Nope. So like on your molars and premolars, those occlusal surfaces, the chewing ones, they're the most susceptible. Then you got your buccal, mesial, distal, and finally lingual surfaces. There's actually a pattern to it.
So there's a logic to it, based on how the tooth is shaped and how we use it. Makes sense. But I see here mandibular molars. Those are the lower ones, right? Those are the most susceptible overall. Why is that?
Probably a few reasons. They erupt earlier, so they're in the mouth longer, exposed to those bacteria. Plus, they tend to have deeper pits and fissures, more hiding spots for the bad guys.
So more time to get attacked, A&D, better places for the attackers to hide. Double whammy.
And get this, the lower jaw gets more saliva. Saliva's good, usually, but it can also mean more plaque buildup if you're not careful.
Whoa, so even saliva, which is supposed to be protective, can backfire.
It's a balancing act. But speaking of saliva, let's move on to the saliva factor. I want to learn more about how it actually protects our teeth. Saliva's pretty amazing stuff. It's like our own little defense system in there. Washing away food, neutralizing acids, constantly working.
So it's not just washing, it's actively, fighting those acids.
Then rebuilding. It's got calcium and phosphate. Those are key for remineralization. Basically patching up the tiny damage to your enamel all the time.
So it's like a repair crew, constantly on the job. That's awesome. What's this about amylase, though?
Amylase. Oh, that's the starch buster. It's an enzyme specifically breaks down starches, those carbs that the bacteria love to feed on.
So it's hitting them from both sides, remineralizing our teeth, indeed taking away their food supply.
Yeah.
Saliva really, Amy is a superhero. But even superheroes have their limits, right? What happens when things get too acidic?
You're right. There's a tipping point. Every liquid has a critical pH, basically how acidic it is before it starts dissolving stuff. And guess what? Tooth enamel is not immune.
Uh-oh.
Yeah, if you don't have enough saliva, like in dry mouth, those bacteria are going to have a field day. Rampant decay. It's not pretty.
Sounds like a recipe for disaster.
Yeah.
So keeping that saliva flowing is just as important as brushing, flossing, all that.
100%. Okay, ready for another key player. Diet. We've touched on carbs, but it's also about the physical form of the food itself.
Wait, you mean like crunchy versus soft, that kind of thing?
You got it. Think about it. Crunchy fruits, veggies, all that fiber, it's like a natural toothbrush. Scrubbing things clean, getting the saliva going.
Nature's toothbrush, I like it.
Yeah.
But what about the stuff that's like the opposite, all soft and sticky?
Yeah, those are the troublemakers. Refined carbs, processed stuff, sugary treats. They stick around, give those bacteria a feast, acid party in your mouth.
Okay, that mental image is not helping.
Yeah.
So basically, more refined carbs equals more cavities.
It's a trend, unfortunately. Again, not NO carbs, but being mindful of what you're eating and what it's doing to your teeth. Ready for some dentist lingo? We're moving on to the GV Black classification.
Okay, hit me with it. Is this like how dentists categorize the cavities?
It's a map of where decay can happen. So picture your teeth divided into zones, right? Class I, those are the ones hiding in the pits and fissures, those tiny grooves on your molars, premolars, mostly the chewing surfaces.
Oh yeah, my dentist is always talking about those.
They're sneaky. Now imagine the spaces between your teeth where you floss. Class II, that's where they hang out, on the proximal surfaces of molars and premolars.
Okay, got it. What about class 3? Different location.
Similar idea, but on your front teeth now. Incisors, canines, those proximal surfaces again, but not involving the incisal angle, so not the biting edge.
Ah, so it's all about the specifics. Class 4 then.
Class 4, same spot as 3, but it does include the incisal angle, so decay on the front teeth, reaching that biting edge.
Sounds worse.
It can be, especially for your smile. Now, down towards the gums, Class V, that's the gingival third, both front and back teeth. Plaque loves to build up there.
Got a brush everywhere. Good reminder. Is that all the classes?
One more. Class 6, this one's a bit unique. It's on the cusp tips, the pointy parts of your molars, premolars, cuspids. Not as common, but still happens.
Wow, a whole system for where the decay is. That's cool.
Right. Helps dentists know exactly what they're dealing with. Now, London Heartbeat Z Academy, they have these awesome images. They show another way to classify based on the anatomy. Let's look at those pit and fissure caries again.
Zoom in. So what makes those ones special besides being hard to reach?
Well, they're in those deep grooves, right? Mostly chewing surfaces of molars, premolars, but they can also be on those buccal and lingual surfaces of molars and even the palatal surface of the maxillary incisors.
So more than just the top of the tooth.
Yep. And toothbrush bristles, they can't really get in there. It's too narrow. Perfect trap for food and bacteria.
Ugh, no wonder those are so common.
Early on, you might see a slight bluish-white color around the pit or fissure. That's the enamel being undermined from below.
A secret attack.
Sneaky, right. And as it gets worse, it spreads sideways, bigger cavity under the surface. That's why checkups and x-rays are so important.
I gotta catch it early. All right, what about smooth surface caries? How do those look different?
So those are on the proximal surfaces between teeth or the gingival third near the gums. Plaque magnets, those spots.
All about fighting that plaque, I'm hearing you.
For sure. Early stage, proximal caries, you might see a faint white spot just below where the teeth touch. It's subtle, but it means demineralization is happening.
So even though it's a smooth surface, there's still that white spot, like a warning sign.
Yep. And as it progresses, the enamel breaks down. Eventually, you get the visible cavity. Speaking of visible, let's talk about those crescent-shaped ones, the cervical caries.
Oh yeah, near the gum line. Those are interesting.
They are usually on the buccal, lingual, or labial surfaces near the gingiva, and they spread sideways towards the proximal surfaces, hence the crescent shape. And if it goes below the gum line, boom, root caries. That's a whole other beast.
One problem leads to another, huh?
Kind of. And cervical caries, they're often open cavities, not those hidden ones. You'd think they'd be easier to clean, but actually it often means not enough cleaning near the gums.
Makes you want to grab the floss right now. Yes. All right, what about root caries? The ones on the actual root of the tooth.
Root caries, yeah, sometimes called caries of cementum, or even get this senile caries. They're more common in older folks where the gums have receded.
Senile caries, that's a bit harsh.
It's an older term, not used as much now, but basically, older you get, more gum recession, more exposed root surfaces.
So that exposed root, that's the key factor for this type.
Exactly. Any soft spot, progressive lesion on that exposed root, that's root caries. And another thing, the bacteria are different here. Filamentous bacteria, long and thin, not those round cauchae we talked about before.
Filamentous, that's like a whole different category of bacteria. Are certain teeth worse for this?
Yep. Mandibular molars, premolars, canines, those are the usual suspects. Maxillary molars can be involved, but mandibular incisors, the bottom front teeth, they're the least affected.
It makes sense. Those are the ones most likely to have the gum recession. Okay, let's talk about how fast caries develop.
All right, speed round. We got acute and chronic. Think of it like sprinters versus marathon runners.
Okay, I'm intrigued. What makes the acute ones so speedy?
Acute caries, they're like, bam, right to the pulp. That's the nerve of the tooth.
Instant toothache territory.
Pretty much. More common in kids and young adults. They're dentinal tubules, those little channels in the tooth. They're wider, easier for bacteria to reach the nerve.
Their teeth are like superhighways for the bacteria.
And they're so fast, the tooth can't build up defenses. Not enough time for sclerotic or reparative dentin. Those are like the tooth's reinforcements.
So it's a race against time. Got to catch it quick.
You got it. Another clue, the entrance to the cavity, it's small, but the damage underneath, that's huge, like an iceberg.
Talk about sneaky. Anything else to look for?
Yeah, when the dentist probes it, there's this giveaway feeling, and the dentin, it's light yellow. Okay, now, the marathon runners, the chronic caries.
The slow and steady ones. Tell me about these.
Chronic caries, they're gradual, they take their time. If they reach the pulp, it's way later.
Less chance of a sudden toothache then.
Exactly. More common in adults, and because they're slow, the tooth can actually fight back a bit. It builds up that sclerotic dentin, reparative dentin, like I said, reinforcements.
So the tooth is putting up a fight. I like that.
It's not going down without a fight. And with chronic caries, the dentin's usually dark brown from that slow, ongoing process.
The color tells a story.
It does. And the cavity itself, it's shallow, not much softening of the dentin, less of an invasion, more of a slow breakdown. Now, we have some other types of caries, too, different ways they can present.
Okay, lay it on me. What other caries characters are out there?
We got rampant caries, nursing bottle caries, recurrent caries, arrested caries, radiation caries, adolescent caries, and early childhood caries. Quite the variety show.
That's a lot of caries. Sounds like they can really do some damage. Let's start with rampant caries. What makes them so rampant?
Rampant caries, they're fast and furious. They hit multiple teeth, sometimes 10 or more, in a single year.
Oh, that's scary.
It can be. And they often attack surfaces that are usually caries-free. It's like they're breaking all the rules.
But who's most likely to get these?
We see them in young kids with their baby teeth and teenagers with their permanent teeth. And both upper and lower arches can be affected.
Sounds like you really need to catch those early. Okay, what about nursing bottle caries or baby bottle syndrome? That sounds especially bad since it's babies we're talking about.
It is a serious condition, but thankfully it's becoming less common these days. Nursing bottle caries, it's a type of rampant caries. It happens when babies are given bottles with milk or milk products for too long, especially at night.
So even milk can cause problems. I thought it was all about sugar.
Well, sugar definitely plays a role, but the lactose in milk, that can be fermented by bacteria too. It's all about the acid, remember?
Right. Acid is the enemy. And I'm guessing it's called baby bottle syndrome because, well, babies drink from bottles.
Exactly. It mostly affects the upper teeth, the maxillary arch, because the milk pools around those teeth when a baby is lying down with a bottle. The lower front teeth, they're usually protected by the tongue.
Makes sense. So limiting bottle use, making sure those baby teeth get cleaned, all important stuff. What about recurrent caries? What are those?
Imagine you get a filling or a crown and then decay pops up right next to it. That's recurrent caries.
So it's like the caries are making a comeback.
You could say that. It often happens because of those tiny gaps between the filling and the tooth. They can become hideouts for bacteria.
It sounds like it's all about the details, making sure those restorations are done really well.
Absolutely. Precision and good cleaning, super important.
Okay, ready for a more positive type of caries? Arrested caries. These are the caries that have decided to chill out.
Chill out, like they're not getting worse.
Exactly. They've stopped progressing, but they haven't completely healed either. Think of them like scars from a battle.
So what do they look like? They usually have a big open cavity, but the dentin, the layer under the enamel, it gets hard and shiny, almost like a natural filling. It's called eburnation.
Wow. The tooth is pretty resilient. Does it need any treatment?
Sometimes dentists just watch them, make sure they're staying put. Other times they might fill them, either for cosmetic reasons or to prevent further breakdown. All right, let's talk about a kind of unique one, radiation caries.
Radiation caries. That sounds serious.
They can be. They happen in patients who've had radiation therapy in the head and neck area.
Why would radiation cause caries?
It's a side effect. The radiation can damage the salivary glands. And remember, saliva is like our tooth protector. When there's not enough saliva, those bacteria go wild.
So it's like radiation-induced dry mouth. That's rough.
Yep. And radiation caries, they have a specific pattern. They often hit the cusp tips, the biting edges, and those cervical areas near the gum line. Can be pretty aggressive.
Sounds like protecting those salivary glands during radiation is really important.
It's super important. Dentists have a big role to play there, educating patients, making sure they're doing everything they can to prevent these caries.
Makes sense. What about adolescent caries? Anything special about caries in teenagers?
Adolescent caries, they're known for being fast movers. They tend to show up during 2 periods between 4 and 8 years old, and then again between 11 and 18.
2 peaks. What's going on there?
Hormones, maybe. Dietary habits, definitely. And probably a little bit of, teenage rebellion against brushing and flossing.
Yeah, I remember those days. So these adolescent caries, they're basically just regular caries that progress really fast.
Pretty much. Catching them early is key. Okay, last one on our list, early childhood caries, or ECC. This is the one that affects the littlest ones.
Early childhood caries.
Yeah.
That's just sad. What exactly is ECC?
The American Academy of Pediatric Dentistry, they say it's any decay in a baby tooth in a kid 71 months old or younger.
So any cavity in a baby tooth, basically.
Yeah. And it's a big problem, especially in lower income areas where there might not be as much access to dental care or education about it. We often see it linked to bottle feeding for too long and lots of sugary snacks and drinks.
It's really all about starting those good habits early for both parents and kids.
100%. Okay, let's switch gears a bit. We've talked about the types of caries. Now let's talk about how bad they are, the severity.
So like different stages of decay.
Exactly. We have 4 stages: incipient, moderate, advanced, and severe. Imagine it like a crack in the pavement, getting bigger and bigger until it's a full-blown pothole.
I like that. So incipient, that's like the tiny crack.
Yep, just starting out, you might see a faint white spot, that's the demineralization, but no actual hole yet.
Well, a warning sign.
Exactly, often only visible on x-rays. Then the crack gets a little bigger, that's moderate.
What happens at that stage?
Moderate, that white spot might be more obvious, and you might start to see the enamel breaking down a little, a shallow cavity forming.
So it's gone beyond just that first stage of weakening.
Yep, the damage is becoming visible. And then, pothole gets deeper, we're at advanced now.
Okay, what does an advanced cavity look like?
Advanced, the cavity's bigger, more noticeable. The decay has reached the dentin, that's the sensitive layer under the enamel. You might start to feel some sensitivity to cold or sweets.
The tooth is saying ouch.
Pretty much. And then finally, severe, the full-blown pothole.
What's happening at the severe stage?
Severe, big, deep cavity, tooth might be really broken down, lots of pain. That's when you usually need more serious treatment.
Wow, this really shows how important it is to catch those caries early before they get to that point.
Couldn't agree more. Early detection, early intervention, that's the key. All right, ready to talk about what happens if caries are left untreated. The consequences can be pretty serious.
Okay, let's hear it. What's the worst case scenario?
So it all starts with those enamel and dentin caries we've been talking about. If you don't treat those, they can turn into pulpitis. That's inflammation of the pulp, the inner part of the tooth.
And that's when it really starts to hurt, right?
Often, yes. Pulpitis can be incredibly painful, and it can spread beyond the tooth. Then you're looking at things like apical periodontitis. That's inflammation of the tissues around the root.
So it's like the infection breaks out of the tooth and starts causing problems in the gums and bone.
Exactly. And if that's not treated, you can get bone loss, abscesses, even systemic health problems if the infection spreads further.
This is making me want to go brush my teeth right now.
Ah.
It's amazing how something that starts so small can have such big consequences.
It really highlights how important oral health is for overall health. Now, let's shift gears and talk about how dentists actually figure out if you have caries, how they diagnose them.
Okay, time for some detective work. What tools do they use?
It starts with a good old-fashioned visual exam, using a mirror and a little explorer tool to check for any signs of trouble. But sometimes caries like to hide, especially between the teeth. That's where x-rays come in. They give us a peek beneath the surface, see those hidden cavities and how bad they are.
X-rays, the caries superhero.
You got it. And there's even fancier technology these days, like infrared laser fluorescence and digital imaging fiber optic transillumination. It's all about using light and cameras to see the demineralization, those early signs of decay.
Technology is changing everything.
It really is. And then we have caries activity tests. These look at things in your saliva to see how likely you are to develop caries.
Like a caries fortune teller.
Kind of. Helps us know who needs to be extra careful with prevention.
Prevention is key. Speaking of which, let's talk about how we stop these caries in their tracks and how we treat them if they do show up.
The good news is caries, especially in the early stages, can often be stopped and even reversed. It's all about giving your teeth what they need to remineralize and fight back.
That's reassuring. So what's the secret weapon?
Fluoride. Fluoride is a rock star when it comes to oral health. It makes your enamel stronger, more resistant to those acid attacks. Think of it like an extra shield.
So brushing with fluoride toothpaste, using fluoride mouthwash, those are our best defenses.
For sure. And for people who are more prone to caries, dentists might recommend topical fluoride treatments or sealants. Those are like giving your teeth extra protection in those vulnerable spots.
Building up those defenses.
Exactly. And of course, good oral hygiene is essential. Brushing twice a day, flossing every day, those are non-negotiables for keeping plaque and food debris under control.
Keeping those bacteria from setting up camp.
Precisely.
Yeah.
And let's not forget about diet. Cutting back on sugary foods and drinks, that's a big one for starving those caries.
Healthy choices for our whole body, including our teeth.
Absolutely. Oh, and fun fact, chewing sugar-free gum with xylitol can actually be good for your teeth.
Wait, chewing gum? Good for your teeth. How does that work?
Xylitol is a natural sugar alcohol that those bad bacteria can't use for fuel. Chewing xylitol gum after meals can help with saliva production, neutralize acids, even help with remineralization.
So it's a treat that actually fights cavities. I love that.
Right, so we've got fluoride, good hygiene, healthy diet, even xylitol gum, all on our side. And of course, regular dental checkups are a must, so we can catch those caries early and treat them before they become a big problem.
Prevention is always better than cure. Well, this deep dive into dental caries has been fascinating. We've covered so much ground, from the causes to the types, the stages, the consequences, even the treatments.
It's been a pleasure exploring all this with you, and a huge thank you again to London Heartbeat's Zed Academy for giving us this incredible material to work with. Their insights have been so valuable.
Yes, a big thank you to London Heartbeat's Zed Academy. And to our listeners, we hope you learned something new today and feel empowered to take control of your oral health. Remember, a healthy smile starts with understanding those tiny but mighty caries.